my name is Katie and I'll be completing your physical exam today, head to toe assessment. Could you please say your name and age?
I'm Brooklyn and I'm 9 years old.
All right, Brooklyn is alert and oriented ×3. She appears to have good nutrition for body. She is sitting upright, has good posture. She has an appropriate mood and affect for cognitive level, and she appears to have good hygiene. All right, Brooklyn, we're gonna start today with your skin, okay? Looking at her skin, I don't see any obvious deformity. I don't see an abnormal amount of bruising. I do see some dryness to the arms and legs here. Other than that, I would say her skin looks really good. Next, we're gonna move to her head. Okay, I would say her head size and shape is normal for her age. Inspecting her scalp and head, I would say her hair is evenly distributed and I don't feel any lumps or bumps in the head there. All right, looking at her eyes, I would say her eyebrows, eyelashes, and eyes are normal with no obvious deformities. I'm gonna take a look here. Her conjunctiva is pink. I don't see any cobblestoning. All right, as far as her vision, we can take a look at the pupils here. Just look straight ahead at me. I'm gonna shine a light in your eye. The left eye reacts to light, and the right eye is consensual to that light. Right eye reacts to light, and left eye is consensual to that. Brooklyn, I'm gonna have you watch my pen light. Keep your head straight and just follow it with your eyes, okay? All right, her eyes are following my pen while her head remains in one place. Checking the 6 cardinal vision. Good. All right, looking at the ears, I would say that her ears have no obvious deformity. There is a lobe piercing notice to bilateral ears. I do not see any excessive wax in her ears though. All right, I'm gonna feel now, okay? Tell me if there's any pain or discomfort. Feeling the auricle and the tragus. Any pain?
No.
Feeling the auricle and the tragus. Any pain?
No.
Good. Okay, moving on to the nose. I would say the nose is symmetrical and located in the center of her face. We're gonna check the nares for patency. Could you take a breath? Good. Let's check the other side. Good. I would say her nares are patent bilaterally. She has no trouble moving air on either side. All right, taking a look at the mouth, I would say her lips are pink and moist. On the inside, her tongue and mucous membranes are warm, pink, and moist. Say ah. Good. Her tonsils are +2. Uvulas freely moving up and down. No obvious deformities of the mouth. All right, I'm gonna check your sinuses. First, I'm just gonna percuss there. Let me know if there's any pain, okay? Any pain or discomfort?
No.
Any pain or discomfort there?
No.
Good. All right, next I'm gonna give you a piece of paper here and we're gonna check your reading close to you, called near reading.
Okay.
I'm gonna have you cover the right eye first and read the top line, okay? Cover your right eye and read the top line.
The dog was fast.
Great. Next, cover your left eye and read the second line.
The book was long.
Perfect. Thank you. All right, next we will check your lymph nodes, okay? All right, tell me if there's any pain here when I'm touching. We have the pre-auricular lymph nodes, the post-auricular lymph nodes, occipital. Then we have the posterior cervical lymph nodes, the anterior cervical lymph nodes. We have the tonsillar lymph nodes, the postmandibular, the postmental, and the supraclavicular. I do not notice any lymphadenopathy with Brooklyn. Everything is within normal limits. All right, next we're gonna look at your neck, okay? Looking at the neck, I don't notice any obvious deformity. No jugular vein distension is noted, which we would not expect any in a 9-year-old girl. Everything looks good there. Checking your range of motion, Brooklyn, can you tilt your head back and all the way to the chin and tilt your head side to side? Great. I'm going to place my hand on the side. Can you push against my hand? Good. And push this way. Great. And then shrug with your shoulders up. Good. She has equal strength bilaterally, neck and shoulders. No limits to her range of motion. Checking carotid pulse. You'll feel me touching here. Carotid pulse is equal and normal rhythm on the right, as well as equal and normal rhythm on the left. Feeling here, trachea is midline. All right, next, Brooklyn, we're gonna move to your posterior chest. If you could just take your legs and swing them to the side for me. All right. I'm just gonna move your hair to the front here. First thing I'm gonna check, Brooklyn, is just to make sure you're breathing normal. Take a good breath in and out. All right, I can note that she is moving air freely and equally bilaterally without issue. I don't notice any shortness of breath or distress in her breathing. All right, what I'm gonna do next, Brooklyn, is called the tactile fremitus. I'm gonna take the heel of my hand, place it on your back. As I move it across, could you just repeat the words 99?
Yes.
Okay.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Great. All right, everything is within normal limits. Next, we're going to just check percussion of the posterior chest. You'll just feel me tapping, Brooklyn. You can breathe normal. Great. Next, I'm just going to listen. Actually, before we listen, let's check for CVA tenderness. What I'm going to do, Brooklyn, is place my hand right over the spot where your kidney would be and give a light tap. You just let me know if there's any pain or discomfort. Any pain or discomfort there? Any pain or discomfort there?
No.
Great. Next, I'm going to listen, okay? When I move my stethoscope, if you could just take a deep breath. Great. Breath sounds are equal bilaterally. I don't notice any adventitious breath sounds. All right, Brooklyn, if you would like to swing your legs back to the front. One thing I just remembered that I'd like to check up top, just to check on those cranial nerves, if you could just clench your teeth and stick your tongue out at me. Perfect. Thank you so much. We're going to move now to your anterior chest. Okay, I'm just going to do some percussing and some listening. All right. As I look at the anterior chest, I don't notice any difficulty in breathing. She seems to be moving air freely and is in no distress. Great. Just gonna listen. Great. All right, looking at the precordium, I don't notice any abnormalities in Brooklyn's thorax. Checking her apical pulse, we'll come to the 5th intercostal space, mid-clavicular. Her apical pulse feels normal rhythm and rate. All right, next, Brooklyn, we're just gonna check your paracordial sounds. You can breathe normal, okay? First, checking with the diaphragm. All right, checking those same sounds with the bell. Good. All right, I notice no adventitious heart sounds. Everything sounds regular. Rhythm is good for her age. I would say her heart rate is right at about 92. Okay, Brooklyn, now if I could inspect your abdomen, I'll have you lay back. All right, just gonna bring my camera a little bit closer here. All right, I would say that her abdomen is soft and flat. I don't notice any obvious deformities. Okay, first thing that we are gonna do is just take a listen, okay? Any pain or discomfort to your belly? No. Starting in the right lower, right upper, left upper, left lower. Positive bowel sounds in all 4 quadrants. I'm going to switch to my bell and listen to the aorta. And I hear no thrill in the aorta. Brooklyn, next what I'm going to do on your belly is just have a feel, okay? So first you're just going to feel me tapping and then some soft pushing, okay? Starting in the right lower, right upper, left upper, left lower. I hear no unexpected sounds. And then some soft pushing. You let me know if there's any pain or discomfort. With soft palpation, I don't notice any grimacing or signs of pain. Now I do a little deeper palpation. I don't feel any masses, notice any grimacing or signs of pain. All right. While we're here, we can look at the legs. I would say that her legs do have some dry skin, but other than that, I don't notice any really cuts, scrapes, or bruises. Going down to the feet, she has good color. I don't suspect any circulatory issues. And then we can feel here for the dorsalis pedis. And it is present bilaterally, checking for posterior tibial. It is present bilaterally and normal. Brooklyn, next we're going to check the range of motion of your legs, okay? We'll start with the right leg. Gonna go straight up, bend it, bring it in towards you, out and in, abducting, adducting. Any pain there with that? No. We'll do the left leg. Up and bend, out, in. Any pain?
No.
Good. Range of motion with the legs is normal, no obvious deformities. Okay, Brooklyn, if you would like to sit up, we can check your arms. All right, let me take a look at your arms and shoulders here. Shoulders, elbows, arms look good, some dryness to the skin. Take a look at her fingernails here. Cap refill is normal, less than 3 seconds. And checking radial pulse. Radial pulse is present and normal bilaterally. All right, Brooklyn, we'll check your range of motion of your arms here. If you could take your arms and put them out in front of you, bring them up, down to your side, and down. Any issues there? Any pain?
No.
All right, Brooklyn's range of motion, upper extremities, is equal and normal bilaterally. All right, next what we can do is we will get our cotton swab here, and we will check your neurological status, okay? So I'm going to take this cotton ball here. I want you to close your eyes. I'm going to touch. You just let me know where I'm touching, okay?
Right cheek, left cheek, left arm, right arm, left arm, right arm, left hand, right hand, left leg, right leg, left leg, right leg, right foot, left foot.
Very good, Brooklyn. I would say that neurological status is intact. Brooklyn is able to feel soft touch bilaterally. Okay, next, Brooklyn, we are going to move on to cerebellar function. What I would like for you to do is take your hands, place them in front of you, and you're going to supinate and pronate your hands like this, and then speed it up if you can. Great, everything looks good there. Next, I would like for you to take your right foot, take the heel, place it under your left knee, and slide it down, and do the same thing on the other side. Great, Brooklyn is able to do that as well bilaterally. I would say that cerebellar function is normal. Okay, what we can move on to next in our cerebellar function is our reflexes. So we'll use our reflex hammer here. And Brooklyn, I'm going to start with the arm here. We're going to check your brachial reflex. You just let that relax right there. Yeah, nice and soft. And then you're just going to feel a soft tap. Are you ready?
Yes.
And what we should see is a little reaction with the arm there, just a little flexion. Good. Let's check this other one. So nice and relaxed. And just a little flexion. Good. Next, we'll check the patellar. Let's adjust our camera here to check our patellar. All right. Our legs are freely dangling here. Good. And we'll check the other. Good. Next, we will move to our Achilles. I'm going to grab your foot here, Brooklyn, and just right behind you. Give it a little boop. And what you'll see is the foot should go down. And check the other. We'll flex the top here. Good. Next, we will check our plantar reflex. I'm going to move to the side here because okay, and this side. Let's check that one more time. Good. All right. I would say that Brooklyn's reflexes are normal and we have no deformity there. All right. Next, Brooklyn, we're going to have you walk. If you could stand up and walk towards the wall over there. And then when you come back towards me, if you could walk heel to toe. Okay, heel to toe. Just come about halfway back here. That's perfect right there. I would say Brooklyn's gait is normal. I don't see any issues with her walk. Next, what we're going to do is a Romberg test, Brooklyn. So if you could just take and put your feet together, which you already have, arms at your side, lift one leg up in the air and close your eyes. Great, and you can put it back down. And she has no abnormalities to her Romberg test. I would say her balance is intact. Last thing we're going to check, Brooklyn, is your range of motion of your spine, okay? If you could just take and bend forward for me, and backwards, and side to side, and give a little twist. Perfect. All right, I would say that her spinal range of motion is normal. No deficits there to spinal range of motion. All right, and that brings an end to our physical assessment today. Thank you, Brooklyn.
Bye.